Sorry, soda drinkers. A study published this week says a can of diet soda each day raises your risk of liver disease by 60%. Sugary beverages are no better. They raise the risk of liver disease by about 50%.
9 News medical expert Dr. Payal Kohli is with us this afternoon to talk all about the study. That is a lot, 60%. So talk to us about some of these findings.
I mean, I was really alarmed because we've been telling diabetics for the longest time, go drink diet soda, right? It's better for you. I've been telling all my patients with obesity, with metabolic syndrome, the same thing. And now as a physician, I'm finally starting to get data that tells me it's maybe not so good for you. Last year, we had a study that told us that erythritol increases our risk of stroke and heart attack and may cause our blood cells to clot, and that's an artificial sweetener. So what are we to do with all this?
Mm-hmm. Well, I love a good diet.
I know you do. She
Call it a
loves
fridge cigarette. You know, you take it out, it's ice cold, it's a nice break. But why is it so bad for us? Because it tastes so good.
Well, so there's lots of reasons. So sugar makes sense, right? When you drink a can of sugary soda, it's got 10 teaspoons of sugar, causes a big spike in your blood sugar that then triggers insulin, which then makes you gain weight and all the other metabolic derangements that happen. Diet soda, it turns out, may do the same kind of thing. It triggers the same sugar circuits in the brain, so it has that same kind of addictive behavior, which is why that fridge cigarette
so good.
Feels so good. Yeah. And it may trigger an insulin spike as well. On top of that, it changes what the gut microbiome, the bacteria in the gut is like. It changes the inflammation. So we think that it's just as bad. And what was really great about the studies, they actually looked at 124,000 people over 10 years.
Okay.
And they looked forward. So they saw how their behaviors today were affecting what they did forward. Now, keep in mind, this was based on recall. So Alex, if I asked you how many diet sodas have you had in the last 6 months?
You're interrogated right now.
It might be hard. It might be hard.
I do like 1 or 2 a week.
Yeah.
So I mean, it's not terrible, right?
Is there a difference between 1 or 2 a week and somebody that's drinking 3 a day?
Well, definitely there's a dose-dependent relationship, but the point I was making was that it's hard to recall exactly how much we've had. So a lot of this is what we call association, maybe not causation, because it's possible you're reaching for the diet soda because maybe you're not exercising as much, or maybe you've gained weight, or maybe you're doing something else that's also associated with this fatty liver disease, which is what we found.
But what liver condition did it cause when they looked in this study?
Yeah, so this is a condition that's becoming increasingly common. I'm seeing it even in thin people, actually. It used to be called non-alcoholic fatty liver disease, NAFLD, but now we changed the name to MAFLD, which is metabolic syndrome associated fatty liver disease. So usually happens in diabetics and heavier people, but now, like I said, we're seeing it in thinner people as well. And what can happen if it progresses for a long time is persistent inflammation in the liver, and you end up getting cirrhosis, almost like a drinker would. And the incidence of this has gone up 50%, with 38% of Americans now having this NAFLD condition that we don't have great treatments for.
This is hard to hear.
I know.
Also, a study came out earlier that said erythritol, am I saying that right?
Yeah.
Erythritol may also be associated with heart disease risk. Can you talk about that a little bit?
Yep, so this is a sugar that's found in fruits naturally. So, okay, so it must be great, right? Because it's found naturally. But you purify it and you give it to people. And the Cleveland Clinic study from last year tells us that those that tend to have higher levels of this natural sugar in their bloodstream have more heart attacks and strokes. And then when they look in the test tube, that's because maybe it causes more blood clots as well. So I'm kind of left asking the million-dollar question to myself now, what am I going to recommend my heart patient?
Is there anything, like if it comes to artificial sweeteners, are you going to recommend anything to them?
So some are better than others. So in this particular study, when people switch from either diet soda or sugary drinks to, guess what, ladies, water, they reduce their risk
that was coming.
of liver disease.
Sparkling
It
water?
can be sparkling
Okay.
with the lime.
Water's water, yeah, right.
With the lime. So you can go for, you know,
lime.
making your
spicy.
sparkling water a little sexy. Yeah. It could also be like a tea, you know, like iced tea or something like that, but just nothing that has too much sugar in it. Now, I will tell you, for most of my patients, I'm actually probably going to go backwards and say a little bit of real sugar might be better than a lot of this artificial stuff. Now, I'm talking about those little mini cans of soda. If you're on the plane, just one little cup. You don't take the full can. Like they offer the full can, just say no to them. But other types of sugar that might be better, stevia is thought to be a little bit better. Monk fruit is a better sweetener than others. The ones that I will stay away from, or tell my patients to stay away from, are aspartame and high fructose corn syrup, because those two are really, really significantly.
So if you had to choose right now, what if I got to grab a Coke in this moment? Diet, regular?
Diet.
diet.
Yes, because even despite the studies, we know that the sugar, 10 teaspoons of sugar is more than your entire daily allowance. So we're still learning about diet. So if you really, really have to have a Coke, a small little Diet Coke, but try to go for that sparkling water with lime.
You can do it, Alex.
You can do it.
I'm good.
But
I
flavor
know
it
one a
once
week.
in a blue
like,
moon.
yes,
Exactly.
yes.
Balance. Dr. Coley, as always, thank you.